Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
September is National Childhood Cancer Awareness Month, and there's very encouraging news to report in the fight against this disease. Here with the latest research, Dr. Sue Hubbard, award-winning pediatrician and medical editor of KidsDoctor.com, and Dr. Ted Leitch, assistant professor of pediatrics at UT Southwestern Medical Center. Dr. Leitch leads the experimental therapeutics program in the Pauline Allen Gill Center for Cancer and Blood Disorders at Children's Health. And as Dr. Sue said, smart guy. That should be his super smart guy. So anyway, nice to have you all here.
Good morning.
Dr. Sue, we were talking a minute ago, and each day 42 families in the U.S. get the news that their child or teen has cancer. This used to be horrible news. Now there's optimism.
There is optimism. I think it's very hard for a family to hear at any time their child has cancer, but we should be more and more optimistic because about 80% of children will survive childhood cancer.
Wow, that's wonderful news, and thanks a lot to people like Dr. Leitch. Dr. Leitch, what are the most common cancers in children, and what's the difference between cancer in a kid and cancer in an adult?
So cancer in kids and cancer in adults is really completely different. The common cancers that we see in children are very rare in adults. The most common cancer in children is called acute lymphoblastic leukemia or a blood cancer. Other cancers in children really arise from the developing organs or the developing brain, which is very different than what we see in adults.
So are there warning signs or are there factors that predispose a child to cancer?
You know, really, Jane, cancer is a random event, and it occurs at the cellular level. So there are some things that may predispose you, certain things like Down syndrome. We know cumulative radiation is really important, and so as pediatricians, we are paying a great deal of attention to who we radiate. And then the thing that we should know, the optimistic part, is that the more childhood infections your child gets, so all these kids that are in preschool and daycare and the moms worry about it,
right,
actually may help prevent leukemia.
Really? Isn't
that fabulous?
That is really, really interesting. So, Dr. Leitch, what type of research is being conducted at Children's and UT Southwestern to improve that outlook, like we were talking about?
So we're conducting a whole spectrum of research, both in the laboratory and in the clinic. I think one thing that's really important to point out is that it's because of cancer research conducted over the last 50 years and all the patients and families that participated in this research that today we can say that 80% of children with cancer are cured, because that certainly didn't used to be the case. But in the laboratory, we're still working to figure out the causes of cancer in children and how we can use those differences between the cancer cells and the normal cells to really provide more targeted therapy that we hope may have less side effects for our patients.
So 80% is the survival rate at this point?
There's about 400,000 adults who are childhood cancer survivors in the United States now.
Wow. Okay, Dr. Leitch, 2 weeks ago, the FDA approved a new gene-altering leukemia treatment for children. How big is that news, and what does that mean for families?
So this is really a revolutionary type of therapy for cancer, where we actually train the patient's own immune system to attack and kill the cancer in their body. We at Children's Health and UT Southwestern have been conducting a study of this therapy for over the last 2 years as part of 13 sites across the country. And we were seeing rates of remission of over 80% for these children with relapsed leukemia, which is something that we've never seen before. And so in addition to helping those patients, and in addition to the FDA approval of this therapy for children with relapsed leukemia, we're hopeful that we may be able to extend this to other patients with other types of cancer in the future, and working hard on that in the lab.
I'm so grateful for people like you. And speaking of gratitude, what's it mean to families in the area to have the Children's Health Gill Center for Cancer and Blood Disorders right here in our community?
You know, it's unbelievable that if we have to deliver that diagnosis, that we can say, we're going to send you to the best and the brightest, and this is where they're going to take really good care of your child, and there's ongoing research. So I think as a pediatrician practicing, in the field, it's huge to me to have these people available. The smart guys.
Smart guy. That's what we're going to call you next time. Just smart guy. All right. Thanks for being here. Appreciate it a lot.
Thank you.
You can go to childrens.com/cancer for more information about childhood cancer, and you can also stay in touch with the latest news and information about raising healthy kids by following Children's Health and the Kids Doctor on Facebook and on Twitter.
Children's Health. We're dedicated to helping today's dreamers grow into tomorrow's doers. With care closer than ever, we'll always be by your side.